Welcome back to Singapore Tonight. Singapore is looking at 3 paradigm shifts in its approach to aging and health. These are to move beyond the hospital to the community, to move beyond quality to value, and to move beyond healthcare to health. And here to share possible tips on how to achieve that, I'm joined by Fabian Lim. He's Assistant Dean for Research and Associate Professor of Exercise Physiology at the Lee Kong Chian School of Medicine. Welcome to the program, Professor Lim. Good to see you.
Pleasure to be here.
So the Health Ministry has actually called for this paradigm shift to go from healthcare to health. What exactly does that mean?
Well, I think that's very important because what it means is that you start to intervene much earlier in the disease process. The disease process don't just happen overnight. It takes years and even decades sometimes to occur. And so the most effective way to tackle disease burden at the population level is to take a preventive approach. And if we're successful in that, we can have a significant impact on reducing disease burden on our healthcare system in the future.
So reducing, that burden, it makes you wonder about this idea of the future old, old people. So why is it so important to start thinking about them now, protecting the health of them?
Right. So the fact is that the state of our health and how well we can function at older age depends on how we live our lives at younger and middle age, right? And we are concerned about the healthcare burden of a quick aging population in the next 10, 15 years. The most effective approach then is to tackle those who are going to be in that category today. Right. That means these people will be probably in the early middle age group and so on.
So, Prof. Lim, behavioral changes, take time.
Right.
It's habit forming in a way, isn't it? So, what are some of the crucial actions that we have to take in order to perhaps make those, big paradigm shifts?
Right. A lot of it comes down to habituation, being habituated to good lifestyle habits. The Singapore government has been doing a lot in creating awareness, in educating the public in good lifestyle habits and providing very good facilities to the public to exercise and be active. But if we're talking about solving an aging and chronic disease problem at the population level, then we really need to shift and go beyond just doing that to creating a culture of active living. So some of the ideas that we can think about possibly is to relook at how we conduct physical education and sports programs in schools, for example. Instead of just focusing on skill acquisition, can we shift that to something that develops habits in exercise as a daily life? After school sports, for example, is a good thing. Today, community clubs, Active SG, sports recreation clubs, they are doing things that has an impact on health of population, but these are not linked to the health outcome of our healthcare framework. And if those two can be linked together, then the kind of programs that are operated by these organizations can have a health focus.
When you say they're not linked, can you clarify what you mean by that?
Sure. I mean, today, if an individual goes through an exercise program, 8 weeks, 12 weeks, there's change in their health status, and there's evidence to show that. But those are not captured in the healthcare system.
Right.
Yeah, so if we can show that link of the programs that's operated by these organizations and the change in the state of health in months, in years, and that as a system at the national level, that can be very effective.
Right, to really see the benefits that they've derived as such. So there is this concept of exercise medicine as well. We're often told we need to exercise more, as you've just mentioned.
Right.
How can we sort of introduce that concept?
Yeah, so the concept of exercise medicine is a growing international trend. And the idea is to position exercise not just as part of disease management framework, but as a core of disease management framework. That's because research data is showing that when you prescribe exercise in complementary or in replacement of drugs, the outcome can be as good or better than pharmaceutical interventions. So the American College of Sports Medicine, for example, has a program called Exercise is Medicine. And what they are trying to do is to train doctors to prescribe exercise over drugs. And in circumstances when that's not possible, there can be a good referral system between the clinician and clinical exercise physiologists who are trained to do those things.
I think more of us need a prescription for lifelong exercise medicine.
So yeah.
Thank you so much for coming in to share that with me, Professor Fabian Lim there.